Okay. Looks like we have a patient arriving right now for the most detailed cranial nerve exam ever. Perfect timing. Let's have the nurse send them on in. Good. Okay. And I already have all of my medical tools. Looks like we're ready. Oh, hello there. Are you the patient waiting for the extremely detailed cranial nerve exam? Perfect timing. Please welcome. Welcome. Come on in. And step 1. Take a seat right at the medical chair that's in front of you. Is that okay? Good. Just relax and take a seat. A couple of introductions before we begin. Welcome to Dream City Sleep Clinic. I am Dr. Cranial. Pleasure to meet you. Pleasure to meet you. Is that chair comfortable enough for you? Good, I'm glad. And do you need any blankets or pillows or maybe some tea? Okay. If you do at any moment, let me know and I can let a nurse get informed to come on in, okay? Good. Today we're here for the most detailed cranial nerve exam that you've ever experienced, correct? Okay. And have you ever had a cranial nerve examination before? Okay. I'll just explain a little bit before we begin. There are 12 cranial nerves. We're going to test all 12 of them today, very detailed, to make sure that you have all of your cranial nerves functioning properly. Okay. And I'm looking at your chart. Could I please get your first and last name? Good. Beautiful name. And your date of birth with the year. Okay. And are you allergic to anything that we need to be known of or informed of before we begin the examination? Okay. Okay. So, now we're going to begin with just basic vitals. One part of the cranial nerve exam is general health, and we like to do a premier head-to-toe exam first, then move on to the cranial nerves, okay? Good. Now I'm going to get some gloves on. And while I put them on, could you let me know why you were referred to get a cranial nerve exam to begin with? Okay. Okay. I saw on your chart, it said that you've been having not the best of sleep and you'd like better sleep. Good. And it said here, it's going to double check your chart, okay, that perhaps you've just been having a bit of dysregulation with sleep, making you stressed, tired, etc. I'll be taking very thorough notes. Okay, so we begin first with vitals. I'm going to ask to place this on your little finger, okay? So just give me one of your hands. We're going to mark your oxygen level throughout the entirety of this exam. Okay? So, give me a hand. I'm going to place that right on your finger. Okay? And you have beautiful nails, so I'm going to turn that to the side. Okay. And is that comfortable for you? Good. Now I'm just going to take a quick look at you. May I put my hands on your face? Okay? It's going to feel a little cold. I apologize. Did you feel me put my hands on your face? Good. I'm going to be taking a lot of notes and asking a lot of questions. Is that okay with you? Good. I'm going to put my hands right there and I'm going to feel your lymph nodes. Is that okay with you? Any pressure or pain when I touched right there at the lymph nodes? None? Good. Have you been feeling any symptoms of like a cold or some sort of perhaps irritation with your sinuses within the past 2 weeks? Okay, any sign of fever? Okay, any sign of severe fatigue? Do you know what day it is? Okay, you know generally what time it is. Thank you. These are part of your cranial nerve, trust me. Okay. Okay, now I'm going to just check your heart rate, okay? I'm going to get a little close for this. It's going to be a little cold. Please pardon my sandwich breath. I apologize in advance. Okay. I'm going to place this right at your shoulder blades. I just want you to breathe in and breathe out, okay? Let's begin. Breathe in and breathe out. I'll be listening. Other side now. Very good. I'm going to place it next to your abdomen, next to your thorax. Just going to listen to the sounds of your stomach, okay? Just relax. Good. And I'm going to place it on your back now. Going to be listening to your lungs, okay? Just going to reach over. Again, pardon if it's cold. Okay, just breathe in and breathe out. Once more, breathe in and breathe out deep. Okay, other side. Breathe in and breathe out. Good, and a little below. Breathe in deep and breathe out. Very good. Seems that your lungs are working well. I'm going to write that down. Do you have any types of asthma or allergies going on within the season? Okay, I'm going to get your temperature now. I'm just going to take your temperature. You're going to hear a beep. Okay. Just relax. Your temperature is currently at 98.6 degrees Fahrenheit. That's perfect. Perfect. And just to double check, I always do it twice. And in centigrade, that's 23.8. That's perfect. Gonna write that down. Okay. Now I'm going to carefully check inside your ears. We'll do a more detailed ear exam afterwards. And I'm going to look up your nose. It always sounds silly. So I'm going to put these in your ears. Do you have any problems with vertigo or maybe some congestion within your ears? Okay. I'm going to just put that right there then. Okay. I'm going to take a look. Just relax. Ear. Okay. Other side. Just relax. Okay. Okay. Both ears seem to be working well. we are going to move on to the first part of the cranial nerve exam now after we've taken the vitals. You appear to be very good. And we're going to test every part and every 5 cranial nerve exams that relate to your eyes. Okay? Orbital, vestibular, all the different types that also connect with the different types of cranial nerves. Are you ready? Good. And do you wear contacts or glasses? Have you had any type of irritation with your eyes within the past 2 weeks? Okay. Any chance you would get a lot of headaches or migraines from time to time? Thank you. I have a pen light here. I'm going to shine this in your eyes, okay? We're going to first keep all the lights on, and then I'm going to keep all the lights off that are in front of us, okay? Good. So, questions are easy. Just answer when you can. Let me know. Do you see a light shining in your eye right now? Yes or no? Good, yes. Put my hand next to your eye now. And do you see the light shining on your eyes, yes or no? Yes. Yes or no? Yes. A little closer now, I apologize for getting so close. Yes or no? Yes. Yes or no? Yes. Okay. I'm going to cover one side of your eye, okay? Let me know the same. Just covering one side of your eye there. Okay. And do you see the light shining at you, yes or no? Yes. Okay, what about now? Yes or no? No. Okay. Yes or no? Yes. And yes or no? Perfect. Yes. Yes or no? No. Yes or no? No. Okay. And then I'm going to ask you a quick question. Is the light shining on me or on you right now? Me or you? Okay, me. Is the light shining on me or you right now? You. Okay, good. I'm going to turn the lights off now, and we're going to continue with a more detailed format of this. Then we'll turn the lights back on, okay? Good. So. Okay. So, we're just going to carefully test the lights again, a little bit darker this time, okay? Let me know, do you see the light, yes or no? Okay. Do you see the light in front of you, yes or no? Yes, perfect. And what about now, yes or no? Okay. You know, yes or no? Yes. And yes or no? No. Okay. Now, is the light shining on me or you? Me or you? Me, very good. Me or you? Me, very good. Me or you? You, very good. Me or you? You, very good. Okay. Just gonna write my results down. Okay. Now I'm gonna ask you to follow the light as best as you can, okay? I'm gonna be looking and tracking with your eyes. So I'm gonna put my hand next to you as well. Just follow the light with your eyes as best as you can, okay? Good. So just relax and just try as much as you can, okay? And begin to follow the light. Good. Good. Keep following the light. Good. 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 Follow the light. Good. Perfect. Follow the light. Good. You're doing great. Good. Good job. You're doing great. Good. Okay, now that the lights are off, I'm going to ask you, how many times do you see the light flash? I'm going to click the pen light on and off. I want you to count how many times you see the light flash on. Are you ready? Let's begin. Keep count. And 3, 2, 1. And how many times did you see the light flash on? Okay, perfect. Good job counting, you got that correct. Any answer between 8 and 10 we see is correct, because sometimes when a light clicks on and clicks off, we can double count, or we can subtract 1. It's very common. Good job. Now we're going to ask you a series of color questions. I have an LED little light here that switches to different colors. You let me know which color you see, okay? And do you have any color partialness I should be aware of? For example, I cannot tell the difference between certain types and certain shades of orange and pink and purple. Okay, good to know. Just try your best. Are you ready? Let's begin. If you can see in front of you, what color do you think the LED light is? Good job. This one is a pink. Good job. Okay, and what color do you think the LED light is now? Good. If you're guessing red, you'd be correct. What color is the LED light now that's in front of you? Good. If you're guessing yellow or orange or even red, you'd be correct. What color is the LED in front of you now? Okay, take a look. Very good. This one's pretty difficult. This one is yellow. Okay, moving on. What color is the LED now? Okay, good. This one actually is a white LED light, and at the very end it is yellow. Okay, what color is the LED light now? Good. This one is a very basic and neutral red. A little bit more difficult to see to the normal eye. And what color is the LED now? Very good. It is blue. You're doing great. Good job. Good job. Good job. And that will be the last of the LEDs. You're doing good. I'm going to turn all the lights back on now. You did great. Now, I'm going to turn the normal light back on, and I'm going to test your eyes in a different way. Okay? So it looks like your color assessment was good. But now I'm going to put some lenses over your eyes. I want you to tell me what you see. Are you ready? Good. It's only 3 lenses. And you let me know what you see with these, okay? This is the first one. I'm going to put that right over your eyes, okay? And let me know, what do you see? Good. Am I a little bit more in focus? Am I out of focus? Am I zoomed in? Or am I zoomed out? Good. I am a little bit out of focus. Good. Good job. That is perfect. Okay, same question, different lens. Okay, am I in focus? Out of focus? Zoomed in? Zoomed out? What do you see? Okay, it is in focus. Good. Moving on. I'll even give you a little test with this last lens. Tell me, what color do you think the lens is? I'm going to put that right in front of your eye. And what color is your vision now? Very good, this is red. I'm going to quickly perform the red saturation test with my little pen light. Let me know when I use my light through this red light pen. Is the pen red with the light, or is the light white? I'm going to flash that at you. Is the light red, or is it white? Very good, it is red. Okay, a little closer. Is the light red, or is the light white? Very good, it is white. Good. Farther away. Is the light red, or is the light white? Very good, it is red. Okay, let me know when the color of the light changes from red to white. Keep focus on the light. Keep focus on the light. Let me know when it changes from red to white. Very good. And let me know when the light changes from white to red. Very good. Okay, that is known as the red saturation test. Under a red lens, your light and peripheral vision will change depending on how close or how far away an object is. Good job. You're doing great. Okay. And then we're going to do one last test, okay? Let me know when my hands move out of your peripheral vision. I'm going to put my hands here and at different distances. And I'm going to wiggle them away from your peripheral vision. Just keep looking at my nose. Do not look anywhere else. And let me know when my hands escape your peripheral vision. Let's begin. Good. Just say when. Good. 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 Now let me know when my hands get into your peripheral vision. Again, keep staring at my nose. Very good. 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 Okay, and that was the eye exam portion completed. So your peripheral, orbital, ocular, and the vestibular version of your eyes functions very well. We're going to be moving on to my favorite part of the exam. This is known as the olfactory sensory nerve exam. Have you had any problems with your nose recently? Perhaps you're not able to smell anything or taste anything correctly. Okay. And do you have any sensitivities to smell? Okay. I'm going to show you different versions of essential oils next to me. I'm going to open them and place them under your nose. I'm going to ask that you keep your eyes closed or do not look at the label. But I want you to take a guess what you think the essential oil could be. As an example, I could have a lemon essential oil. I will take it and I will carefully put it under your nose, and you take a guess what the smell of it is. Perfect? Good. Let's begin. Keep your eyes closed or look on the wall. We're going to start with the first one here. And this one's generally typically easy. The essential oils will get harder as we continue on. Okay? Good. Starting with the first one here and placing that under your nose. Okay. And what do you think this one could be? Okay. A little bit citrusy. Very good. And almost like an orange. Very good. Any guesses? Orange is correct. Good job. That's why this one is typically the easiest. Okay. On to the next one. Are you ready? Good. This one is lovely. Again, they will get progressively more difficult. Now this one is under your nose. Let me know what you think. Okay, very minty. Good, like a mint. Any guesses? Perfect. This one is eucalyptus. You're doing great. This one smells amazing. Let's move on. Keep your eyes closed or keep distracted and look at the wall. Oh, this one smells amazing. Okay. This one's under your nose now. Okay. And what do you think this one could be? Okay, a little bit like plants, like flowers. Good. This one is very good. This one is lavender. Reminds you of a spa, doesn't it? So nice. I find this one to be one of the most pleasant. Okay, let's continue. Okay, now this one is wonderful. Yeah, this one's pretty good. Okay, what does this one smell like to you? Take a guess. Very good. This one is, yes, super similar to the outdoors, to a fireplace. What do you think that could be? Perfect, some sort of tree or bark. That is exactly it. This one is sandalwood. In my opinion, it smells like marshmallows, but it absolutely smells like an oak or wood. It's lovely. Good job. Let's move on. Oh, again, this one's good. Also, it appears right here when I take a look at your information, it appears that your heart rate is decreasing, meaning that you are finding this to be relaxing, which is exactly what we were looking for. Good. So we have this one right here, and this one is one of my favorites. Okay. Keep your eyes closed. We're just going to place that right next to your nose, okay? Good. And what do you think that is? Marvelous. Floral. And it reminds you of an herbal tea. Maybe a sleepy time tea. Good. Any guess? Floral, flower, perfect. This one is chamomile. You were supposed to get that it smells like a flower, earthy, and just well, we would have accepted the several answers here, which are notes of marshmallow and notes of vanilla. Good job. And now we have one last one. And this one is fantastic. I adore this one. Oh, lovely. Okay, this is the most difficult. Most people do not get this one correct, and that is okay. It's just a test to see if your sense of smell is able to pick up on some of the notes, okay? And what are you getting? Yes, earthy, citrus, and a little bit of medicinal. Perfect. And you guessed what that could be. Yeah, okay, not really. Perfect. You can open your eyes now. This one is tea tree, and it smells like a citrus herbal type of plant. It is commonly used as a topical ointment for your face and scalp, typically used for dermatitis, some sort of dandruff, and acne. It is much used medicinally for face, skin, hair, and follicle irritation. Good job, you did amazing. And we're going to move on now to your sense of taste. We just tested your sense of smell. And I have 2 bottles. I'll show you them. Okay. And these little bottles have 2 different tastes. There are 3 that you're going to be able to pick from. We have sour, sweet, and salty. In each of these bottles is a different flavor profile. You guess from each one if it is sour, sweet, or salty. Are you ready? Let's begin. We're going to start off with this one here. Say ah. Very good. Just drop a little bit. Okay. And then go. Good. You got that right away. Is it sour, sweet, or salty? Good. That one is sour. Very good. I saw your face make a okay. I'm gonna move on to this one now. Okay, say ah. Okay, and then taste it. And what is that? Is that sour, sweet, or salty? Good. That one is super sweet. Perfect. Okay. You're doing great. Good job. Now we're going to give you a refresher. And what I'm going to do next is we're going to be testing your vestibular and your ocular nerve version of your body, which is balance and your sense of hearing. Okay? Do you have any signs of vertigo? Okay. Do you get vertigo at all? Okay. And do you sometimes feel off balanced? Okay. I'm going to put my hands behind your ears. I want you to let me know what you hear, what you feel, etc. Okay? Good. So, is that okay if I put my hands right here? Good. I'm going to carefully just put my hands to your ears like this. Okay. Okay. And applying a little pressure. And released. Are you feeling any sense of unease and unbalance? No? That's exactly what we want to hear. Very good. Now I'm going to ask you to keep your eyes closed and let me know if you hear a sound coming from your left or your right side, okay? Good. Let's begin. Keep your eyes closed. Left or right side? Good, that's coming from your left. Very good. Left or right side? Good, that's coming from your right. Left or right side? Left? Left or right side? Right. Good job. I'm going to twist and turn your neck a little bit, okay? I want you to let me know how you feel. First, gonna just tilt it at an angle. Okay? Relax. Okay? Are you feeling okay? Good. I'm going to whisper something in one of your ears. Let me know what I say, okay? Welcome. 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 And what did I whisper in your ear? Welcome. Very good. Let me know, can you still see me? Good. I'm going to quickly use my pen light here. Follow the pen light. Good. Are you feeling dizzy at all or feeling any chance of vertigo? No? Okay, good. Okay. I'm going to twist your neck the opposite direction. Okay, relax. Okay. And are you still able to see me? How do you feel? Okay. I'm going to whisper something into your ear again. You repeat and let me know what I said, okay? Blanket, 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 blanket. And what did I say? Very good. Repeat after me. I said blanket. Very good. You're doing amazing. Thank you for allowing me to just continue with this, okay? We're detailed for a reason. Now I'm going to do the same as the other eye. I want you just to follow the light with your eye, okay? Good. Follow the light. Good. Follow the light. Good. Follow the light. Good. And do you feel any sign of vertigo or some sort of imbalance or fatigue? No. Okay. I'm going to put you back where you were before. Okay. And can you look at me? Good. Can you look at the wall over here? Okay. Can you look at the wall over here? Okay. Can you look at me again? Good. Do you see my hands focusing in front of you? Good. And do you see my hand behind me? Good. Okay. How many fingers am I holding up out of 5? 5, very good. What about now? 2, very good. What about now? 1. What about now? 3. What about now? 2. And what about now? 3. Good. Any signs of imbalance or vertigo so far? Okay, none of that. And how are you feeling? Just a little bit tired. Okay, we are going to test your brain function now. I'm going to ask you to do some musculature tests, and we're going to test your brain, okay? Good. So, I'm going to ask you to play this game with me. It's called Repeat After Me. I'm going to raise certain parts of my face and my arms and my shoulders. I want you to repeat, okay? So, lift your eyebrows as if you were excited, okay? I'm going to put some pressure on that. I want you to try your best to keep your eyebrows up or the muscle in tension that I tell you to when I touch your face, okay? So, eyebrows up. Okay, keep going, keep going, keep going. Good. Relax your eyebrows now. Let's do your eyes next. I want you to try to close your eyes as tight as possible. Do not let me open them. Okay? And close your eyes. Keep going. Keep going. Don't let me open them. Good. And relax. Look at me normally now. Okay? Look all the way up here. Good. Relax. Look at me. Look all the way down here. Relax, look at me. Look over here. Look over here. Look back at the center. Good. Now, can you give me a very comical smile? Thank you. Good. A little bit of pressure. Perfect. Now, relax, okay? And give me a frown. Good. Perfect. Relax your face. Okay. Now I'm going to ask you to raise your shoulders like so, okay? Just raise your shoulders. I'm going to put pressure on your shoulders. I want you to resist for me pushing down, okay? Raise your shoulders and resist. Resist, 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 resist. Okay, relax. Good. Now, I'm going to ask you to put your hand on my hand, and I want you to try to resist me pushing forward, okay? Put your hand on my hand, and resist, resist. Good. Other side, put your other hand on my hand. Okay, pressure and resist, resist, resist. Good job. Now, I want you to shake my hand, but squeeze my hand as tight as possible. It won't hurt me, okay? Good. So, hold my hand. Good. Perfect. Good. Other hand up. Good. Perfect. Good. Good job. I'm going to cover one of your eyes, and I'm going to ask you to follow my hand with one eye. Okay, covering one eye. Follow my hand movement. Just follow my hand movement. Good. Good. Perfect. Eyes are focusing. Good. Covering the other eye now. Just follow my hand movement. Follow my hand movement. Good. Perfect. Okay. I see no signs of one eye overworking or stress. Muscles are working perfect. Good. Good job. I'm just going to carefully test some musculature. I'm going to tap on your forehead, your nose, your chin, and your shoulders, and your knees. And we're going to see if your reflexes are working, okay? Good. So just relax. Good. Good. Forehead good. Nose. Good. Good. Chin. Good. Good. And try not to kick me, though it is okay if that happens, okay? Okay, relax and bend the knee. Good. Good. Other side. Good. Good. Now give me your arms. I'm going to put a bit of pressure right there on your wrist. Good. Once more. Perfect reflex. Other side. Good. Perfect reflex. Now I'm going to test your ankle. Again, try not to kick me, okay? Test your foot. Perfect. Good. Perfect. Good. Okay. Reflexes are working well. And now begins a series of different types of questions. We're going to be testing your brain and reactivity to your other parts of your musculature, okay? So, I'm going to ask you a series of questions. Just answer to the best of your ability. You got that? Okay. If I were to say 2 birds with 1 stone, what does this phrase mean to you? Okay, that means you could accomplish 2 things by doing 1 task. Good. Okay. Okay. If I were to tell you, look over yonder, what does that mean? Okay. That means look over there, or in some cases, look over here. Good. Okay. If I were to say, leave no rock unturned, what does that mean? Okay, that means to look for anything that could possibly be missing, or to consistently check through every single piece of information. Got it. Okay. What is a fortnight? Okay, perfect. It is either 2, in some cases 4 nights after the same previous night that we were currently on. Returning in a fortnight. Good. Okay. And one more time, do you know what date it is today? What year is it? Do you have a job or do you go to school? What's going on? Okay. A series of brain questions continue. I want you to let me know what is on the card. I have several sets of cards in front of me. I want you to identify as quick as possible what is on the card. Okay, I'm going to show you 5 different cards. I'm going to need you to answer as quick as you can. Okay, good. So, let's begin. What's on the card? Perfect, that is a dog. What is on the card? Good, that is a cake. What is on the card? Good, that is a tree. What's on the card? That is a bus. Very good. Okay, and what is on the card? That is an apple. Good job. On to the last set, sensory. Okay. I'm going to ask you, is this warm or is this cool? I have a atomizer, and what this does is it will apply a little bit of moisture to the skin. I want you to let me know if it is warm or cool. Are you ready? Let's begin. Is this warm? Or is that cool? Okay, good. Just relax. Is this warm? Or is that cool? Good, that is warm. Very good. And last but not least, before I give you a moment to hold your thoughts while I type some information, okay? I'm going to ask you if something is soft or sharp. This is what soft feels like. And this is what sharp feels like. You let me know if it is soft or sharp. Okay? Good. Let's begin. Close your eyes. I'm going to place this on your cheeks. Soft or sharp? Good. Soft. Soft or sharp? Good. Sharp. Soft or sharp? Soft and soft or sharp? Good. Sharp. Okay. I'm going to write some details down now. I'm going to leave you in the room just for a little bit while I set a little bit of information in. We're going to be collecting data on how you relax sans doctor in the room, and we're going to be filling out and completing the information on your detailed cranial nerve exam. This is known as the rest and recovery part of it, and I'll just be typing alongside. You might hear that, but we're going to be turning all the rest of the lights off so that you can fully relax, okay? Good. So I'm just going to move my stuff and I will be right back, but we're going to let you rest, okay? Just move that over there, okay? Okay. And looks like we've finished all of our information. Rest and recovery was complete, but we'll give you all the rest of the information as soon as we possibly can. And we're going to be filling out this info and sending it to you two by tomorrow, fully detailed, okay? Okay. Thank you for being here today. And we'll put you in the rest and full recovery room after now so you can sleep, and we'll monitor your heart rate, etc. Got it? Good. We'll see you tomorrow morning. And thanks for being here for such a detailed exam and being such a good patient. Good. Need any help, hit the button next to you. You know how to do this, okay? Cheers, darling. Thanks for being here today.